Good afternoon, folks. This is Robert Chappell, Executive Editor of Madison365 with your daily update for today, which is Monday, July 26th. I'm here in Green Bay, Wisconsin. I know you saw live from Green Bay. I'm sure you thought Lambeau Field or Resch Center or something like that. No, it's just a hotel room downtown Green Bay. I'm here. I've mentioned a few times that we are part of the new News Lab, the Northeast Wisconsin News Lab. We're covering the Racial Equity Ad Hoc Committee, which is meeting tonight. That's why I'm here to cover that meeting. We had two terrific reporters working on this project on racism as a public health crisis and the county's work to counteract that. They have both moved on to their next internships. They did a great job for us. So I'm kind of pinch hitting to is a transition period here until we get to the next thing, which we will announce hopefully in the next couple of weeks. We'll have more news for you on our expanding coverage, our growing coverage of northeastern Wisconsin. To the main thing today, though, COVID numbers, not great. Again, this is new data since Friday, right? So you expect on a Monday to see a lower number of new cases, right? We see just less testing performed over the weekend, fewer positive test results, fewer negative test results reported over the weekend. However, even with that smaller expectation, we still have 312 new cases today. And our 7-day average of new cases has gone all the way up to 351. Still, way below crisis period of last fall. And when we peaked at like 7,000 cases a day, right? However, 312 is still a lot more than what we've seen recently. Of more concern, however, positive test rate. Remember, we've been talking about this, trying to get it below 3.0 for a long time. And we did. We got it below 3.0, all the way down to 0.7 in May and June. I even said in June, like we did really well last year, and in July it started to go up again. Well, same thing's happening. We came back up to 3.0. And 3.0, there's nothing magical about that number. That's just like the number that public health folks will tell you. If you're below 3.0, you have it under control. You're doing good, right? And if you're over 3.0, then you got to start talking about closing things and wearing masks and distancing and all that stuff. So last week, we saw it go from about 2.0 or a little like 2.3 over the course of the week, went all the way up, and on Friday was at 3.3. Okay, on Thursday it was 3.0, Friday was 3.3. It took a 0.3 of a percentage point jump from Thursday to Friday. So I was unhappy about that. I said 3.3 is bad news. Today, 4.1. Over the weekend, it jumped from 3.3 to 4.1, 0.8%. Now, positive test results get priority in reporting. So it is possible. I don't think this is likely, but to give it the most charitable interpretation, it is possible that the last 2 days, Saturday, Sunday, saw a smaller number of negative test results and a slightly higher number of positive test results, which might artificially inflate the positive test rate. Again, I think it'd have to be really disproportionate to bump it up 0.8%. It would have to be wildly disproportionate to bump it up by that much. So I don't think that's it, but it's possible that that's part of it. The bigger problem is we're just seeing more infection. Now, what the state does not make readily available, at least easily in a dashboard, it might be in here somewhere that I just don't know where to look for it, but is the breakthrough cases, I should say, the breakthrough cases, right? Of those 312 new cases, of the 4.1% that tested positive, how many were vaccinated? I would hope that there was at least some level of people who've been vaccinated who are now testing positive, either because they're just part of surveillance testing right? If they're healthcare workers or those kind of folks are just getting tested all the time. And might test positive even though they don't feel anything because they're vaccinated, right? Now, if a significant number of these positive cases are in vaccinated people, then we won't see a spike in hospitalizations and deaths, right? Because if you're vaccinated, chances are, if you test positive, it'll be fine, right? You'll be okay. You won't have to go to the hospital. You probably won't die. So we should see, normally without vaccine last year, every time we saw a spike in cases, we saw a spike in deaths about 4 weeks later. So we got to kind of hold our breath, cross our fingers for the next, 3 or 4 weeks, see if we see an uptick in deaths. Because it takes that long for people, first of all, to go through it and to die, but also then for that death to be reported, confirmed into the state data. Now, we are seeing an uptick in hospitalizations. Not a huge uptick, a smallish uptick. We are now at 194 people hospitalized. And apparently we're having a thunderstorm here in Green Bay. But 194 hospitalized is a low number, right? That's not the problem is not that we're going to see hospitals get overrun. We're not at that point. You got to get to several thousand people hospitalized before that's a problem. However, it does indicate that there is a severity of illness, which means that most of these folks are not vaccinated. The folks that are getting testing positive now, not vaccinated. 194 is 9 more than Sunday and 59 more than a week ago. So we are seeing an increase in hospitalizations, but we see a corresponding increase in deaths in 2 weeks. We have to hold our breath, cross our fingers, and hope not. But I would not be surprised. Right now, our 7-day average of deaths is 2. We're having 2 deaths reported per day. At one point, that was 60, right? If that goes in 2 weeks from now, that goes up to 10. Like, that's pretty bad. It would be I don't think it's going to get back up to 60 with half the state vaccinated. But, 30 is pretty bad. For comparison, the leading cause of death in Wisconsin is heart disease. 31 people per day die of heart disease in Wisconsin. Okay, that's just a comparison. So at one point, COVID was twice as deadly on a daily basis as heart disease. That was only for like a month, though, right? But if we get back, if that 2 deaths per day, if we keep on this path and we're back up to 30 by September, October, that's pretty bad. I don't know if we're going to get there or not. I hope not. But until we get more people vaccinated, that's going to happen. Because here's the thing, we're not going to close schools again. We're just not. There might be I could see Dane County, I could see Racine County, Milwaukee County reinstituting a mask mandate, which is then not enforced. I don't see any will at all for any further lockdowns or lockdowns of negative term, closures of schools or businesses, health orders of that kind. I just don't see that happening. And this Delta variant is apparently very, very contagious. So we've still got 3 million people in this state that are not vaccinated. And an awful lot who also have never been infected. So there's a lot of fertile ground yet for that Delta variant to spread among vaccinated and unvaccinated populations. So get your vaccine, even if it's not 100%, even if you might test positive at some point, get the vaccine so that we can keep this, so that even if we have a surge in cases, we don't have a surge in deaths. That's what we're trying to avoid. Right? Now, the other thing is, the longer we get we go unvaccinated, the more chances we have of more variants. Right? The longer we have this is how evolution works. If the virus is circulating in vaccinated people, it will mutate and adapt to the vaccine, and actually vaccinated people will then become more vulnerable, possibly. So, you can't necessarily assume that the next variant will be more will be worse than Delta. A variant is just a variant; it's just different. It doesn't mean worse, better, or whatever. It might be Zeta before we get another bad variant. So don't assume that like Lambda variant is going to be, or Gamma variant, it will be automatically worse than Delta. Delta's pretty bad. Leo says that the resistance to vaccinations has me bewildered. When you first saw that, I thought you meant the virus's resistance. I was like, no, virus isn't resistant to the vaccine. It's fine. But you're talking about people. Federal Communication Commission, because television and social media has surely made at least American populace stupid and dangerous. Can't entirely disagree. I think there's been, here's the thing. This is my political rant for the day. Since the 1980s, this is my lifetime. I remember this happening. I watched this happen in real time. There's been a steady, intentional erosion of trust in institutions. Right? Ronald Reagan and the Reagan Revolution was, no, please do not trust in government, which then bleeds over into don't trust in institutions. Right? Don't trust the medical establishment. Don't trust journalism. Don't trust media. Don't trust government. Don't trust the city or the county or the mayor or the president. It's just like this steady erosion of trust. And this is the consequence. And when people don't trust the institutions tell you that the vaccine is the best way to get out of this. The automatic response is to do the opposite among a lot of people. Not everybody, obviously. But, it seems to be about half the population. Michelle asked a good question. Do you think vaccines will be mandatory in the near future? I do not think so. I think not in Wisconsin. I would imagine some schools will require a vaccine. I know, like Marquette University, for example. If you want to go to Marquette in the fall, you have to be vaccinated. UW Oshkosh, I just saw today, is raffling off scholarships. If you get vaccinated, you have there are 10 scholarships that will be given away, random drawing of people who are vaccinated. I'd rather, why don't you just require a vaccine to come to the school? I can see some localities, some municipalities requiring vaccine. Given the current makeup of the Wisconsin Supreme Court, a vaccine mandate would not stand up. It would be immediately challenged, and given that if they won't even allow the state to require masks, they will never, ever in a million years allow the state to require vaccines. The only way a vaccine mandate would happen in Wisconsin is if the entire legislature and the governor's office agreed to institute a mandate through the proper rules making so that the court could not overturn it. And I don't see that happening either. And there are states where vaccine mandate could happen. I could see municipalities not necessarily mandating vaccines, but mandating that anyone who's unvaccinated loses certain privileges. Like if you're unvaccinated, you have to wear a mask, and we're going to make you show proof of vaccine before coming into places. That kind of thing. Right. Yes, this is absolutely true. As Julie mentions, schools with state funding, which is basically all public schools, have a hard time setting up a mandate because if you actually, that's a good point. I hadn't thought about that. The EW system. One reason the EW system, as Julie says here, is not mandating is because probably the state legislature would threaten their funding, which is absurd, if you ask me. But also that could also carry over to school districts who just don't want to incur the wrath of the Republican legislature who say they're in favor of local control. Okay, anything else on COVID? Let me see. No, I think that's it. The chart doesn't look good. The chart is like this, and then it's like this in the fall, and now it's like dipping back up, which I don't like. at all. Okay, so I'm in Green Bay. As I said, I'm unable to set up my cool little screen sharing thing so I can show you the graphics from the stories. So we're going to take a short break. You hear a word from Pastor Maricor, and I'll be back in 15 seconds, and I'll just talk through some of the other news of the day that you want to know, and we'll get on our way. I'll be right back. Do not scroll away. Just give me 15 seconds. I'll be back right after this.
Hi, my name is Megumi. I serve at AmeriCorps because it is the perfect opportunity to work with middle school students and to grow in important skills such as leadership, responsibility, and communication. You can serve too. Learn more and apply at www.passamericorps.org.
Okay, a couple things on the site today, Madison365.org. Just go to the site, check things out. The first big thing is we've announced once again our second annual list of the most influential Native American leaders in Wisconsin. We started this last year. It kind of got overshadowed last year a little bit because we did it the week of March 11th, not realizing that the world would come to a halt. I'm sorry, and then March 9th was the Monday. March 11th was the Wednesday when UW closed, and March 13th was the Friday when schools closed statewide. So we set this up to do a 5-part series. Last year was 38 most influential Native Americans, and like the whole entire world came to a screeching halt like in the middle of that week. So that kind of got overshadowed a little bit. So we're announcing there's a second cohort or second list, 24 people this year, and it's a wide range of folks. And some folks are leaders within their nations, in their indigenous communities. Many are not. Many are leaders just in the corporate world, in the nonprofit world, in healthcare, in law, in the UW system. So we talk a lot about Tyson. I'll catch you up in a second. We talk a lot about Native American cultures, indigenous cultures, as if we're trying to remember them, as if they're in the past, but they're not, right? They're right here with us. We are on indigenous land, right, that we took from them. So it's important to acknowledge them. I'm up here on Oneida land. If you're down in Madison, you're on Ho-Chunk land. So it's important to recognize those folks. So look at the site this morning. It's there now. It's the 24 most influential Native American leaders. There's 5 today. There'll be 5 every day, and then on Friday there'll be 4. So it's 24 people. Take a look. Get to know those folks. Reach out to them if you want to. They're from all over the state too. When we do our Black Power list and our Latino list, those are kind of heavily centered in Madison and Milwaukee, whereas the Native American folks are really spread out all across the state, which is really cool. Tyson, I don't know that we are effed. I think we're kind of getting there. The positive test rate is 4.1 today. It was 3.3 on Friday. That's the gist of it, and that's pretty bad. We have not yet seen a corresponding increase in deaths. We are seeing a slight increase in hospitalizations. So that's the gist. If we're not effed yet, we will be pretty soon, probably, if we're not careful. Okay, other news today. Abdul Karim Njai is from Madison. He's originally from Gambia. Has been in Madison for a long time, 14 years. He lived in Madison for 14 years, moved to Colorado for 4 years, now he's back. And is starting a new group called Climbers of Color. He's been into rock climbing. Well, he says, the way he says it, he's basically been into rock climbing his whole life, because he said, I grew up in Africa. Of course I've been climbing things. But kind of got into rock climbing, like the rock climbing gym scene about 10 years ago. Got involved in an organization in Colorado specifically for people of color. And is starting a similar organization here. Everywhere he goes rock climbing, he says there are Black people around, but they're not climbing. Like he goes to Devil's Lake, Governor Dodge, some of those great state parks around Wisconsin, and he's the only Black person climbing the rocks or at the climbing gym. So he's trying to create a space where people of color who have never tried this can come and try it. And it is, and I cannot speak to this from experience, obviously, but I'm told repeatedly that it is kind of just exhausting to be the only one wherever you are, wherever it is. If it's recreational, professionally, whatever, it's just hard to be the only one. And so he's trying to create something where you're not the only one at the climbing gym. And there's this idea that like this is just a thing we don't do as Black people or brown people. And he's asking why. So the first meetup is tomorrow night At Boulder's Climbing Gym on Stoughton Road, on the east side. It's $10 for a couple of hours. It's all the equipment, everything. It's 50% off that Boulder's Gym is giving them. It's open to do it at least once a month, probably more. Maybe at gyms in Milwaukee, Brookfield, around the state, and maybe just get the outdoors a little bit too. So that story, I talked to him yesterday. That story is on the site as well today. In international news from CNN, speaking of Indigenous people, Canada has finally installed an Indigenous Governor General. Mary Simon is she's the first Indigenous person to serve as the official representative of Queen Elizabeth II. Remember, Canada is a Commonwealth of the United Kingdom still. So the Queen still is sovereign over Canada and appoints a representative, and that representative is Mary Simon, who is Indigenous. So that story is from CNN. It's on the site right now. Sporting news for Madison was going to win on Saturday. The referee announced 8 minutes of stoppage time, which if you don't know soccer, the clock is kept on the field, right? It's not external to the game that the referee keeps the time. And anytime play stops, he kind of like keeps a tally of how much time has gone by, and then he adds that on to the end of the game. He added 8 minutes on, which is a lot. And then he let it go for 11 minutes. And in the 11th minute after the game was supposed to be over, Fort Lauderdale, who was visiting, scored to equalize the match, and Madison had to settle for a tie. And it was absurd and terrible, but they played very well. And now they go to Chattanooga on Saturday of this weekend, and then off to Omaha on my birthday. So I'll be down there for that. All right, that's all I have for you today. I hope you are masking up. I hope you're keeping cool in this very, very hot weather, and I hope you have a wonderful evening. I'll be back home in the studio tomorrow afternoon, and until then, take care, and we'll see you tomorrow.
This is 365 Media.